Hello, my name is Kobe Obert, and I'm doing my presentation on gallstones. Alright, first I want to start off by talking about the gallbladder and what it is and its main function. The gallbladder is a pear-shaped organ that is located under the liver and on the right side of the abdomen. Its main function is to produce, store, and transport bile when needed. On this slide, I just talked about like bile and gallstones, just the basic information on them. All right, so bile's makeup is 70% bile salts and acids, 10% cholesterol, 5% phospholipids, and 5% proteins, and the rest of it's made up of water, electrolytes, and bicarbonate. Okay, gallstones. There are two main types of gallstones. One is cholesterol gallstones, and the other is pigmented or bilirubin gallstones. Cholesterol gallstones make up anywhere from 75 to 90% of all reported gallstones. And they can range in size from a grain of salt all the way up to a golf ball. Alright, so the cause of cholesterol gallstones, there's two main causes to it. One is the body produces an excess amount of cholesterol, and so there's not enough bile salts and acids to attach to the cholesterol, so it sits there and it just sits there and clumps up. It builds up and it mixes with calcium deposits and mucin glycoproteins, and over time this turns to like a sludge type stuff, and over the course of anywhere from like months to years, this hardens up and eventually forms the cholesterol stones. And the second way of this is like a lack of motility in the muscular wall of the gallbladder, and this can cause the bile to become stagnant, and this is another way that the cholesterol gallstones form. All right, for the pigment gallstones, they're less common than the cholesterol gallstones. They form when there is too much of the unconjugated bilirubin. And when there's too much of the bilirubin, it combines with calcium, and when that combines, it forms a solid substance. It's called calcium bilirubinate, and because it's made of partly calcium, it is what is it called? It's called radio opaque, and that makes it to where it's visible on an X-ray. And because it's partially made up of bilirubin, that is what gives it its dark color. All right, so the common risk factors of getting gallstones, it affects 10 to 15% of the U.S. population, and I read somewhere that that's about 20 to 25 million people. By age 40, women are 3 times more likely to be diagnosed with gallstones than men are. That it's more common in women in general, but by that age is 3 times more. Being pregnant also increases the risk of getting gallstones. Being obese, rapidly losing weight also causes gallstones. People that belong to a certain ethnic group, such as Mexican Americans or Native Americans, they are more likely to get gallstones as well. And obviously family history, that plays a role in it also. If you have a family history of gallbladder problems, gallstones in general, then you're more likely to. A high cholesterol diet also contributes to it, because cholesterol is the main cause of it. Symptoms include nausea and vomiting. This is because when the gallstones get stuck in either the bile or pancreatic duct, it causes inflammation of either the gallbladder, the pancreas, and stuff like that, and that causes the nausea and vomiting. Dark urine is due to the gallstones blocking the bile duct, and it makes it to where that the bile becomes infected, and when that infected bile gets into the urine, it causes the dark urine. A jaundice color, yellow coloring, is because of the blockage of the bile duct. It doesn't allow the bile to get to the intestines, and the bile acids is what causes it doesn't allow it to reach the intestines. And abdominal pain is caused by the gallstones lodging into one of the ducts, and that causes inflammation, and that's what it puts off pain in the abdomen. Pale or clay-colored stool. This is caused by the bile salts. It's caused by the bile salts released from the liver. That's what gives the stool like the brown color. And when there's not enough bile reaching the stool, then it ends up having a clay or palish color. Okay, so the gallstones are diagnosed in two main ways. One is an abdominal ultrasound. This is the test that most people use. It moves a transducer back and forth across the stomach area, and it creates images that show the structures in the abdomen. So if there was a gallstone, it would find it. The next one is an endoscopic ultrasound. This one is mostly what people use to see if they missed anything from the abdominal ultrasound. It is mainly used to detect smaller substances. This one passes an endoscope through the mouth and through the digestive system, and the transducer that's within the endoscope, it puts off sound waves, and that picks up smaller, it makes an image and picks up smaller gallstones if there are any. And then blood tests can also be used to find gallstones, because it can reveal complications like infection, pancreatitis, stuff like that. If a blood test was to reveal that, one can conclude that gallstones could be an issue. All right, the most common treatment for gallstones is just to remove the gallbladder, just because it's easier and quicker. It's just what most people pick. The next one is medications, such as ursodeol. I don't know if I'm saying that right, but it's another common form. It's probably the second most common form of treatment. What it does is it reduces the amount of cholesterol produced by the liver and absorbed by the intestines. It also it works to dissolve any excess cholesterol, because the excess cholesterol is what leads to the production of the gallstones. Some people try to let the gallstones pass naturally, which this doesn't happen most of the time, but it could happen. Most of the time, other treatments are needed, but some people like to do this, whether they can't do the other ones due to financial reasons. And some other people do home remedies, like drinking lemon juice or apple juice or olive oil. Some people use this and try to flush out their gallbladder. Less than half of the patients with gallstones are symptomatic, And so if people aren't symptomatic, then most of the time they won't even need treatment. Gallstones can also lead to other complications such as infection, inflammation of the gallbladder, pancreas. In bad cases, it could lead to gallbladder cancer. Gallstone complications can it worsens the effects on the person also. Medication and dietary changes are two ways to get rid of gallstones if you didn't choose the surgery. Yeah. And that is the end of my presentation. Thank you.